Social Work 7402, Final Evaluation by Kayla Miller. So the basis of my evaluation was focused on the anxiety in youth. It's no secret today that more and more youth are suffering from anxiety. The Anxiety and Depression Association of America reports that 1 in 8 children are affected by an anxiety disorder. These youth often experience different types of anxiety at different times of their lives. For example, younger children tend to experience phobias and separation anxiety, while older children tend to develop social anxiety as peer relationships become more and more important in their everyday life. The same organization goes on to state that about 80% of those children with a diagnosable anxiety disorder are not receiving any treatment. And this is very significant because, as our next study shows, children who suffer from anxiety also have an increased risk of developing a subsequent depressive disorder. Often anxiety that goes untreated tends to develop into depression. Also, substance use is of higher risk because it is often utilized as a coping mechanism for the anxiety and/or depression. And lastly, again, the Anxiety and Depression Association of America reports that children with anxiety are more likely to have poorer academic performance and may miss out on important social experiences. Sometimes when we have anxiety, it leads to a lack of focus on what we should be paying attention to. And also, a lot of times with anxiety, we cope by using avoidance coping mechanisms. So our anxiety keeps us from doing that because of the fear or the anxiety that comes with such action, like attending a party or engaging with a group that we're not familiar with. For my methods of implementation, I have decided to address the issues of anxiety, stress, and worry on youth in the school setting because that's where my field placement is taking place with a program called Go Zen that provides information and coping skills to students focused on anxiety. All students that participated in the group attend a local rural middle school that has about 800 students in it. It has a very diverse population in regards to race and ethnicity, as well as socioeconomic status. 4 students were chosen selectively from the 8th grade. They were chosen by the school social worker based on their past meetings with her that were focused on addressing their anxiety. Not only did I need to implement a program, but I also needed to figure out a way to evaluate this program. So a pre and post test one group design was utilized to evaluate the program and its outcome measures. This allowed me to compare participant status before and after the program intervention was implemented. However, this is a case study and it was very low in internal validity and level of rigor due to not having a control group, and also I could not control any outside forces or discern if any of those outside forces had an effect while the students were participating in this group. I used a series of scaling questions in my pre-post test to provide a numerical value to the different aspects of the questions to help compute calculations of p-values and effect sizes. The pre-test and the post-test were comprised of the same questions, so I could get an accurate reading on the before and after. Here are the questions that I utilized on my pre and post test. A couple of them involve scaling, while a couple asked for the frequency of the feelings of stress, worry, and anxiety, or the frequency of the use of coping skills. As you can see, what the options were: a few times a month, few times a week, once a day, multiple times a day. I added numerical value to these so I could determine afterwards in my analysis a numerical value to see if there was a positive or negative effect. So like I said before, I had used this program called GoZen. The program design is a case study as we are observing a small group of students to see the effects the program has on them. The program utilizes psychoeducation and coping skills based on cognitive behavioral therapy to help students manage their anxiety, stress, and worry. These coping skills ranged from breathing exercise, so diaphragmatic breathing. It also utilized imagery, and we also used skills such as laddering to break down big, daunting goals that these students had. This was a 6-week program that would meet for 52 minutes during each session, and it is comprised of animated videos and worksheets that would encourage practical application and discussion of the information presented. In regard as to why I chose this type of intervention, there was a lot of evidence out there that supported psychoeducation and coping skills to reduce anxiety and act as a preventative measure. One study by Conley and Associates conducted a meta-analysis in which interventions utilized social skills training, cognitive behavioral therapy, psychoeducation, and relaxation skills, and they concluded that there is empirical support for positive effectiveness of prevention programs, and like I said, GoZen uses these components. Collins and Associates conducted a study utilizing psychoeducation and coping skills based on cognitive behavioral therapy, and they saw a significant reduction in self-reported anxiety and avoidance coping skills and an increase in problem-solving coping skills. So again, these aspects is what the GoZen material is based off of. It implements as well. After I implemented the program and collected all of the pre and post test, I now had my results. In regards to the frequency of anxiety, 3 out of the 4 students reported a decrease in the frequency of these feelings. With my calculations, there was a p-value of 0.09 and an effect size of negative 1.225. Both of these show that there is unfortunately no statistic or practical significance in regards to this program on the frequency of anxiety. Looking at the intensity of anxiety, all 4 participants did, although, report a decrease in the intensity of their anxiety and stress and worry. A p-value of 0.02 reflects that there was some statistical significance in the numbers that we had. However, the effect size of negative 0.2185 shows that this program, however, was not practically significant. Now we can interpret the results of the frequency and effectiveness of coping skills. In regards to the frequency of coping skills, 2 out of the 4 students reported an increase in use of coping skills, 1 reported no difference, and 1 reported a decrease in use of coping skills. Here we were actually looking for an increase in use because we were hoping that it would address and prevent further anxiety. The p-value of 0.34 reflects that this is not statistically significant. However, the effect size of 0.57 shows that this is somewhat practically significant, so it shows that the frequency of coping skills may have been improved by the program. The effectiveness of coping skills, 1 student reported no change in the effectiveness of coping skills. However, they did report it very high at a 9, meaning very effective. But however, 3 others reported that there was a decrease in the effectiveness of their coping skills. A p-value of 0.09 supports that there was no statistical significance, and the effect size of negative 1.225 reports that there was also no practical significance. Here we continue on with our results. With this last question, there was no numerical value. However, I thought it was very important to note whether or not these students have had their anxiety or their stress or their worry prevent them from completing tasks such as homework, chores, family time, hanging out with friends, after school activities, etc. Prior to the program, all 4 students reported that their stress, anxiety, worry has prevented them from doing so. Following the program, only 2 of the 4 reported that the anxiety, stress, and worry prevents them from doing these, and 2 reported that their anxiety no longer prevents them. So there was a slight improvement there. And lastly, in the very beginning, students were asked if they were seeking outside treatment for anxiety. Not that this would prevent them from participating in the group. However, I would have withheld their results because it would not have given me a clear answer as to what is helping their anxiety improve. So I didn't want their outside treatment to affect the group, nor did I want the group to affect their outside treatment. Fortunately, all 4 students reported that they were not receiving treatment from any outside agency. Fortunately, I guess, depending on which way you look at it. But for the sake of this evaluation, it did help that I did not have to withhold any of their pre-test and post-test due to that. Overall, we can see that this program was not high in effectiveness, and I think that is for a couple of reasons. Unfortunately, my group had many limitations. First of all, there was very small participation. I only had 4 students. There was quite a bit of inconsistency in meetings. Not all sessions happened consecutively in 6 weeks like I would have liked. The weather here in Ohio was pretty predictable, so we had quite a few cancellations, and unfortunately we were holding them on every Monday, and I could not carry those over into any other day of the week. We had limited time. We did not always get the full 52 minutes, again because of the weather. We often had school delays, and it seemed to always happen on a Monday, in which our time was cut only by 10 minutes, but that was pretty significant, as I don't think the 52 minutes allowed for everything that we needed to do. So I needed more time overall for discussion, reflection, and practice application of the information presented. There were many distractions and lack of focus by students. I actually contribute this to my lack of experience in managing middle schoolers. I should have been a little more controlled with what I allowed them to do during the group. Next time I would have all materials except for what we need for group out of their reach. That way they weren't tempted by doing other homework or trying to check their phones. Lastly, there could have been outside forces increasing the anxiety, stress, worry, such as we have state testing coming up, and I know many of my students were worried about that. And I know a couple of them did have some personal issues that came up at home that I believe could have affected their presence in the group. So some lesson learned. I learned that there's always room for improvement. Like I said, there were many factors that I did not consider, as this was my first group and evaluation that I ran. There were unforeseeable scheduling issues, many distractions, just my own inexperience in running group and guiding these participants to be very engaged. So going forward, there are quite a few changes I think I would make in my future studies and evaluations.